Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. As you know, Apollo Hospitals has always been at the forefront in creating health awareness. And with all our FB live sessions, we have been bringing to you information on diseases, on path-breaking treatments, latest technologies, and medical innovations so that you can prevent and tackle diseases that are hindering your good health. We're also delighted to bring you seasonal and trending information so that you're always well armed with awareness at all times. As the temperature dips in many parts of the country, it is certainly a matter of concern for every parent about the well being of their child. Not only has the weather turned damp or cold, pollution too soars at this time, not to mention the incessant rains that are still happening in some parts of the country. And then, with schools opening and children now suddenly getting released from their home confinement and getting out and playing and meeting their friends at school, threats of infection also loom large, and COVID is still with us, and that threat also looms large. But there is nothing to be gained by listing all this and worrying about what could happen. Instead, it's more important to know what to do to keep your children healthy and happy in winter. So, come, let's talk to Dr. Smita Malhotra, consultant, Pediatric Gastroenterology-Hepatology, Indraprastha Apollo Hospitals, New Delhi. And let's find out exactly what you need to do to keep your kids well in winter. Dr. Smita Malhotra has a DNB in Pediatrics, MRCP-CH from the UK, and also is an IAP fellowship holder in Pediatric Gastroenterology and Hepatology. She has also had a short-term training in Pediatric Gastroenterology and Hepatology at PGI Chandigarh, and she has been with Apollo Hospitals as a consultant in both hepatology and pediatric gastroenterology. She has authored chapters in several books, such as the IAP textbook of pediatric gastroenterology, where she has written on liver transplantation in children. And also, she's written about autoimmune liver diseases, treatment and prognosis, and also in the IAP on pediatric liver transplantation in the IAP recent advances in pediatrics journal. She's also presented several papers in this specialty and has participated in several CMEs in not only pediatric liver transplant, but ulcerative colitis and celiac disease in children. Welcome, Dr. Smita Malhotra, to this session. And I'm delighted that you're here to put our viewers' minds at ease and tell them what exactly to do to take care of their kids in winter.
Hello, Dr. Srinidhi. Thank you for giving me an opportunity to air my views on this platform. Yeah, I know parents must be very worried with the change in weather and the pollution. So this will be just a very basic, so that the general things many of you may be knowing, maybe it will just act as a reinforcement and with a little medical edge. I'm open to all questions that you would pose to me from your viewers.
Yeah. So to begin with, what are the general precautions that one should take to keep kids healthy during winter?
See, in the winters, it depends where you are staying, which part of the world you are. In India, the winters can be very harsh in some parts of the country, especially in North India and especially in the hilly regions. So, the basic dictum is always to keep the babies covered, especially the younger babies. They lose their body surface area, they lose a lot of heat through their skin. So, it's very important, and this is common knowledge in all households. Our grandmas and nannies all tell us that you keep the babies covered. So, when you just sense a nip in the air, to keep the babies covered, they keep their hands, give them mittens, give them socks, give them a cap. So keeping them covered is important, and that varies. The covering varies according to the degree of the cold. So the general comparison usually is that how many layers we as adults need. You need one extra layer for a child. But on the same side, I would like to warn that sometimes parents, really overdo it very much. We
Surely.
say this very much, especially in newborns, that they are bundled in so many layers that they start sweating. and the baby presents with fever, which is actually not fever, it is the heat because of the excessive covering. So you'll have to, balance it and see, and the covering should not be so tight and too much that it causes discomfort and excessive heat to the baby. So according to the weather, according to the this thing, just keep layering and covering the hands and the head, hands and feet in the head. So that is one thing for the covering part. Other things, yes, nutrition. I always advise about nutrition. That is not just winters, it's every season, every year, every stage of life. Uh, Healthy nutrition is very important. It's important, I think, as a pediatrician, what I have seen in this present generation is that children are just not eating home cooked foods, they are not eating fruits, they're not eating vegetables, and there is so much available, and there is there is so much variety and so many things very easy to procure, and with the buying capacity of the family is also becoming better and better. So if children, even from the strata we would say are not that economically privileged, will also be on a lot of unhealthy diet, biscuits, packaged fruits, all these things. So these are things which we have to discourage as a general measure, not just for any season, but for every season, for every day, as a way of life. That I think is very important.
What are the diseases that kids often get during winter? As
See, we
in,
all know that when winters come, respiratory infections, bronchiolitis, influenza, these things become more common. So it is actually not because of the cold; it's because of the viruses. These are the viruses which, in heat, in hot temperatures, these viruses are not able to thrive. So in winters, it is the exposure to these viruses which causes these. So the main problems which we face are respiratory problems. Then there are certain diarrheas also which you will have more in winters. Then there is the skin diseases, people who are allergic or who have eczema or those things, because of excessive dryness and scratching, they will have this. Children, even I'm a liver specialist. Children who have chronic liver disease usually have a lot of itching in the skin, and that skin becomes dry, so that gets aggravated. So these are the usual problems that we see in winter. The other things I would say, which we see in other countries, like foreign countries, where there is, there can be snow bite, there can be, all these frost bite, all these kind of things. These things we don't see much in our country.
uh, so talking about influenza, so could we discuss a little more about that? As in, why do
Yeah, I think influenza.
we get so prone to
Yes.
influenza, and
So
what?
this is the time, from July to October, every year we have a new vaccine which comes in for influenza. And still it is not in our national schedule, it's an optional vaccine. So traditional thought has been to give it to children who have some special conditions. So at least that cohort of children should definitely get the influenza vaccine every year. The ones who have asthma, the ones who have nephrotics, who are on steroids, or who are suffering from cancer, who have immune deficiencies, who are on treatment for that, or who are transplant patients. So these diabetics, these are the groups, they definitely should get it. And the others also, if they are able to take it, is good. We would say an yearly influenza vaccine should be a part, and it will prevents a lot of morbidity, because influenza causes, you lose school, you lose you're well and down with the flu for, sometimes it can be more than a week, 10 days. So an influenza shot, and not just, I would, really like to highlight this for the viewers, not just children. It is very important to give the influenza shot to the elderly in the family. Everybody who is above 65, they should also be given. And I think for kids we do the vaccination, but the concept of vaccination for the elderly just doesn't exist anywhere. We are still not, very open to that idea. With the COVID vaccine, at least we gave COVID vaccine to all. But then there are other vaccines also which are mandatory. And since we are talking about influenza, I would like to say yes, younger children, especially newborns, prematures, and also the elderly, they should be given the influenza shot annually. And the time is usually September, October, before the season starts. That time they should take the shot.
So parents often ask whether, like apart from the cohorts that you mentioned, that people who are immunocompromised, what age should all children, if they have
Above 6 months of age. Above
and
six
they
months of
have
age.
access to the vaccine, and if they can
Yes,
use it,
yes,
they should.
yes, yes.
Certainly.
All practitioners do the vaccination. They
Yes.
should do it. Yes.
And what are the other preventive measures should they?
See, we
What?
all know basic COVID has taught us the preventive measures from respiratory, avoiding overcrowding, avoiding cramped places, closed doors. Sometimes, there's a small room and the doors are closed because you don't want a draft of air to come, cold air to come, and then there's heating, centralized heating and all. And then there's if there are too many people in the same room, or you are socializing a lot, you're partying a lot, all those things. So overcrowding you need to avoid, especially since the COVID scare is still not gone away, and we now everybody's scared about the new variant. So even the older variant is still not totally gone. So the same precautions which we have been advising for this hand washing prevents lots and lots of infections. Most of the viruses, they go from our hands to the doorknobs, to the surfaces, to the clothes, and then they spread from one to the other. So, thorough hand washing is very important, and it is a practice which should be inculcated in us. Like, I mean, we should not be able to pick up something and take it to our mouth. It should be an inherent reflex. If we want to put something in our mouth, we should first wash our hands. Same is the way with the guardians, that it should be in their reflex that they need to wash their hands before they prepare or assemble food, before they serve food. And these hand washing has to come in a big way in our culture. So it traditionally was, but then things, became sort of changed. The society became very fast and a lot of norms changed. But I think thorough hand washing is very important. Avoiding overcrowding is important. You want to meet, outdoor sports are always welcome for children. They should play out, but then in the out, the risk of catching, these this the aerosols will just spread away. They'll be blown away. So out, if they want to meet friends, they want to play and all those things, it should be more in the open. So these are the precautions, and obviously good diet, warm foods, hot liquids, all these things should be done.
Um, Children, I mean, mothers often have this doubt that, they should not give things like ice creams and cold things to children during the winter. But how relevant is that really?
See, I think one very this myth is about citrus fruits, juices.
Yes.
People avoid oranges and this group of lemon, all these things in winters. Actually, these are a very good source of vitamin C. Amla is a very good source of vitamin C. So are oranges, and these are things which I always tell my parents that nature is much wiser than we are. So if this produce comes in winter, that means it's meant for winters. So then the vitamin C content prevents from lots of respiratory infections. So in fact, these are the things we should advise. It's not that even if you will take something which is very chilled, the cold surface, it may affect you, but it's always like there are lots of families who will not serve curd during winters. They will not take buttermilk during winters. They'll not take oranges during winters. And so it's these are foods which are naturally fermented foods, and they are in fact curd and buttermilk have lots of probiotics. They also prevent from infections. So these are things which actually should be encouraged, that around the clock, around the season, they should be taken. It's only that you just don't take something which is very chilled and put it directly in the child's mouth. You can just let it come down to room temperature and then serve it.
We were talking a bit about the fruits and about the diet. What are the other diet related tips that you could? I mean, I know that a balanced and healthy diet is a necessity all day of the year, but is there anything particular? Because in India, we do have quite a few of these
See, I am a very big advocate of our traditional grains. I believe that our the world is going back to millets, and they have a higher protein content. They have a higher content of many minerals and nutrients. So our traditional millets we should incorporate in our diet, especially in winters. People do take, but otherwise round the year people don't take. So millets should be included in the diet. One should go for whole grains. It is better to go for whole grains rather than going for refined foods. Uh, we all know that ghee in moderation is accepted and recommended now. Then there are no contraindications for taking egg and egg yolk. There was a lot of time when these things were, totally a no-no for everybody. But children, they need the vital nutrients which are there in the egg. Egg is a very good source of protein, and especially the yellow part also has lots of dense. It's a dense nutrient source. So children should not be denied these things. They should be given whole eggs as a good source of protein. And it's believed that the multiple colored foods, they have a lot of antioxidants, so there should be a wide variety of colors in on your plate. So the brighter the colors, the different colors, why if you want to buy a brinjal, the the purple, the better the purple, the brighter the purple, the better is the vegetable. Same is for the greens. So you should try to include, you may include red amaranth, include colored bell peppers, include different colors because they have different antioxidants and different nutrients. So that should be there on your plate. Where you should have at least 4 to 5 servings of fruits and vegetables in a day. So they include lots of, uh, these are things which I think should become a way of life, and not just for the babies, for not just for the children, but for the whole family. Because unless and until the whole family eats the same food, the child will not eat it. So these are things which should be included in our diet. We all know that the things which cause the most harm are sugar and salt. So our traditional gourd and jaggery are much better than sugar. So these are the changes which we need to include. And in some ways, we have to adapt from newer things, and in some ways, we have to hold on to the good that our civilization has handed us down over generations. So that is what we need to do.
What about dairy products, milk, and curd we spoke about, but is that
Yes, the problem which with milk is that, especially in North India, which is the dairy belt, we see that the children, especially till 3 years, 4 years, they are predominantly on a milk-based diet. So that has it makes us stress in our OPDs also to cut down on the milk. Otherwise, milk is a good source of, it has healthy protein, it has good amount of calcium, it has nutrients. So milk, there are two things which is there, that milk should not replace your meal. Once a child is above 6 to 8 months of age, milk should not replace a child's meal. It should be limited. But otherwise, yes, milk is required. Milk should be given. It should not be diluted. Like we have seen lots of families adding water to the milk, so that should not be done. It has to be given to the children, but in moderation, in an amount which does not replace the meals. Because in that case, if I have seen small children, just 10 months, 11 months, being given 1 to 2 kgs or liters of milk in a day. So if that much milk the child takes, then they'll become constipated. There's no fiber in the diet. They become iron deficient because milk is a poor source of iron. So balancing is required. And I would anyways any day advocate replacing the same amount of milk with curd or buttermilk, because that has probiotics. It is fermented, so that is better.
What about other respiratory infections? We spoke about influenza, but what about bronchiolitis and bronchitis? And
Yes, even the allergies
what
worsen
are the
during winters.
symptoms?
The children who are asthmatic, their allergies will worsen. So what they can do is they can, they can take their there are certain medicines, preventive medicines, which we can start for known asthmatics. We know they they can go on to preventive medication before the season starts changing, which will prevent them from aggravating their symptoms. The ones who are on inhalers, it's always a step up and step down therapy. So depending upon what stage they are, that can be modified. So these measures have to be taken. Then they should avoid lot of what heavy curtains and lots of dusting, heavy carpets, these things, pets, these things in these children should be avoided. Open fires, if there is a if somebody is using, normally we don't in our homes, but if that is there, so these are things which should these will prevent from respiratory problems. As far as bronchiolitis and all are concerned, we know always that these mostly the symptoms will be mild and they will be self-resolving, but sometimes children will need hospitalization. So there is not much you can do to prevent it, but there's just timely treatment, timely therapy. If they need some oxygen support, so they should be better. But then there are the general measures which I have elaborated earlier. These are the ones which will prevent you from these things. And normally it is the bacteria, the virus will come from the elders or the other older children in the home. So just being usual hygiene practices, avoiding overcrowding. These are what we need to do.
Absolutely. Next, we'll, I think, move on to skincare, because the other thing which worries many people is the dry skin. And
Yeah, yeah.
what kind of skincare regimen can be followed for babies and for little older children
See,
in
the
winter?
first thing is that hygiene is important. We see some many parents, they will not give their baby a bath fearing that they will catch a cold in winters. So that they're even older children I have seen for days together in winters, they will not be taking a bath. So keeping the skin clean and clean and washed thoroughly every day, that is important. So a regular warm bath is required. Obviously, you cannot use very hot water because then that will scald you. But warm baths are recommended. Smaller babies sponging with the ones who are in the ICU or anything, the regular sponging is done. So it just because it is winter does not mean that that washing is to be denied. So a regular daily bath is very important. Moisturizing is very important. So just using any good moisturizer is important, that it keeps your skin moist and hydrated. There are some people who prefer coconut oil, even that is good, there's no harm. So just keep, and then just not layering up too much, because if if you sweat and along with that you have some lubricant, so that will then you'll have boils and all those things. So that becomes important. Children who are prone to eczema, that might worsen during winters. So there also, the more hydrated the skin is, the better they will be. So they'll just need to maybe use a moisturizer at least 2 times a day, at least in the morning, then once again in the evening when they come home and change. So depending on your skin condition, you'll have to intensify the moisturizing.
Um, is there any, yeah, we already spoke about bathing the baby, but is there any particular kind of a massage or something that is required for a young baby before bathing with coconut oil, or, there are
No, we
different.
don't recommend anything in particular. It's not that you just need to use. In fact, first 1 month we don't advise any skin products, not even baby products. So after 1 month, you can, whatever locally is used can be used. Coconut oil is good. Many communities use coconut oil, so that is fine. That can be used.
We touched upon asthma, but could we elaborate a little bit on, of course, children who are already asthmatic need to kind of review their medication and they need to be careful about pollution. But are there any other preventive measures, and are there any warning signs for these
See, the
patients?
preventive measures I already told you,
Yeah,
avoiding heavy curtains, avoiding
yeah,
heavy carpets, not
okay.
keeping pets in the house, avoiding pollen, uh, open fireplaces, and some, if there is, if a child is asthmatic and you want to renovate the house, or there's a lot of, you just
Dust and
dust is being generated and all those things. So those things we need to be careful about. These are the things that will prevent, and then there are medications which will prevent. So preventive medications, like we use montelukast and all those can be given to the children. So these are what we do for prevention. For treatment, it is the symptoms which will guide you. The warning signs, obviously, if the child uh, begins to feel a bit breathless, or that you can, it's the if they start feeling tired very soon while they are playing or exercising, these are the signs there. Or they might have which starts with a cough, and especially if it is worse in the night. So these are all symptoms of asthma. If the child is coughing more in the night, then we think more of asthma rather than a routine dry cough.
Um, what about, we were talking about the influenza vaccine for children, but is it also okay to give there is a vaccination schedule that the child is following? Some people think that when it is raining or when it is cold, it's better to postpone the vaccination.
No,
So,
no, no,
you
no. There's
advise.
no need. No, no. Vaccines can go as it is, and there is a schedule. But if there is a few days up or down, that doesn't matter much. If there is a mild viral or something, sometimes they might wait for a 2 or 4 days. But otherwise, with seasons or with the climate, there is no change in the vaccination. No. That has to continue as per the schedule.
Another important complication that happens during the winter months, at least in some areas in the country, is the additional air pollution. And sometimes, this also aggravates respiratory symptoms. So, what is your advice for children who live in these kind of areas where air pollution is?
Same as I mentioned for COVID, try to avoid going outdoors as much as possible. Obviously, you have to go to your school. Masking for older children can be done. Very small children, the masking is also not. N95 mask is very good to prevent from pollution because it filters out all the pollutants. So older children can use the mask comfortably, a good fit mask. So I think COVID has taught of lots of things. Previously, for pollution, we would not use a mask. Now we don't think of, there was a lot of this thing.
We are used
So
to it now.
a lot of inhibitions with masking and all those things. So they are all now gone. It's become for the last 2 years. It's like a part of our lives. So for the whenever there is excessive pollution, definitely masking should be done and avoiding outdoors as much as possible.
Are there any special infection control precautions that you should take about in the house during winters?
I think I've already stressed on all the things that we need to do. Infection control,
You know,
yes.
for COVID, we were saying that, we need to kind of make sure that, a lot of sanitizing was done, a lot of
See,
people were wiping most of the surfaces,
most of the winter infections are actually through aerosols and droplets.
not through the
Those
surfaces,
not and the amount of wiping and surface cleaning we require, I think we require all the year round. So
yeah,
mainly, I think what will help us is hand washing. Even if we touch something which is a surface which is
and wash
contaminated,
our
we keep
hands.
our washing our hands frequently and using sanitizers. So we never used to use sanitizers before COVID came. So that should be like, I mean, at least medical people use sanitizers in hospital when they see a patient, touch a patient. But general public has never even thought of using sanitizers before the COVID era. So I think that should stay with us. That should stay with us, and that will prevent a lot of infections. In fact, we have seen in the COVID times that other infections came down a lot because of the precautions which we were using for COVID. Number of respiratory infections came down. The number of asthmatics came down. Even tuberculosis incidence has come down. In cases have come down in this time because spread is all the same. It's through the droplets and the aerosols and through the cough, for instance. So that helps.
Absolutely. Is there anything else that you would like to advise parents about winters?
I would not just winters, I would say every season. What we have, one thing which we have not touched, which is a very important part of health, is fitness. I think lots of children are just sitting in front of their mobiles and their computers, so that concept of playing together with friends and community playing has been replaced by indoor games and all those things. So I think a regular exercise schedule or a regular play schedule or a sporting, being part of sports not just helps you as a physical exercise, it prevents it it's a mental exercise as well, it's a social exercise as well. So I think for all children it is very important that they should have their playtime, they should go out, they should run about, they should be part of some sport that, and that will have an impact on all aspects of their life, including infections, whatever season it may be.
Absolutely. Thank you, Dr. Smita Malhotra, for this wonderful discussion. And parents, now that you have had all your queries answered, do keep your kids safe, warm, cozy, and well this winter. And don't worry, enjoy the season without anxiety. And do subscribe to our YouTube channel to get the latest information on trending healthcare topics. And you know that if you have more queries, you can always reach out to us on our Facebook page, or you can post a message in our inbox, or you can put a comment. So, till the next time, stay safe, goodbye, and see you soon. Namaste.
Thank you, Srinidhi. Thank you.